Hello and welcome back everyone to my channel. This is Dr. Shukan Wadhawana. Today we are going to discuss something very important, which is for Fmge students who are going to appear in the June exams. The topics that are going to be coming that I feel which have been important for the time that I gave the Fmge exams. Okay, so I'm going to enlist around 10 to 15 of topics which could be potential questions coming from the anatomy point of view. Let's just begin right away without wasting any more time. An approach which is going from head to toes. So first we'll begin with the head, and the head we have the nerve pathways. Nerve pathways is being the first one. It being the pathway from 1 to 12 cranial nerves, where is the passage from and where they return the blood supply as well as everything too. Now the second one that I want to give is the type of the hematomas that can form into the type of hematomas. Can be subdural, extradural, subarachnoid, all these kind of hematoma, the characteristic way, the keywords which are being asked in the exams. Fourth one is the floor of the fourth ventricle, right? So what are the topographic relationships of the fourth ventricle? So the very high yielding of them is actually the brainstem syndrome. So we have different types of syndromes. Know about all of them. I would highly suggest you that if you have got some free time during your preparation, know about those brainstem syndromes, go through them 5 to 6 more times actually, because they are high yielding questions coming from them. One or the other question will definitely come from the capsule, right? So what are the injuries that happen to the internal capsule, the gain, what kind of injury happens in the artery supplying to that can get ischemic, the area getting to that will be ischemic, what will be the problems facing into that. Okay, the retrolentar part of it, basal ganglia, right? So basal ganglia is also much more important into forming all the memories. So know about it. Topographic relation, the anatomic relationship of those with the other part. And we have the blood supply of the brain. So you have to know about the blood supply of the brain, which is also very much essential, like this internal carotid artery. Then there is middle meningeal artery, which part of them they supply to the part of the brain, which part of the brain they supply to: anterior cerebral artery, middle cerebral artery, posterior cerebral artery. It is vertebral and basilar artery are going to get asked if they get ischemic, what is the possible consequences. Pharyngeal wall, what according to the pharyngeal wall is holding high importance because of the vocal cord location as well as the muscles that are involved over there, which is very much important. The branchial arches are the ones which are highly important. What are the things that they're going to form into? So I would suggest also that being a very high yield topic, that you have to know about branchial arches and what they form in triangles of the neck. Again, a high yielding topic in the anatomy, which can be potential exam questions. Is like, what are the borders of the triangle, what are the constituents, what are the contents of the triangle. You have to know about all of that, not only of the neck but also the triangle that we have, femoral triangle. So triangles are important in the entire body, which are highly. Callet's triangle is also there, but that is more of a surgical. We won't discuss it in being anatomy, but for this point of view, I'm just trying to say that these are landmarks, particularly the eponymical landmarks are very much important. Now we begin with the third part, that is being the spinal cord. What important things about the spinal cord you need to know is the nucleus that we have over there, as well as the most important of all of them is about the ascending as well as the descending tracts, and what are the things that they carry. Some carrying pain and temperature, some carrying proprioceptions, what are the nucleus that they give their fibers into, what are the places that they form the decussations over there, and what are the radiations that are happening onto the brain. All these points are very much important, so you have to know them. And then we begin with the other part is, apart from spinal cord, then we also have thorax. For thorax, I think like the most important questions I can on the lungs part of I can say, like, what are the most bronchopulmonary segments that are involved in this disease. Supposedly if a patient has had tuberculosis, so what of the lungs lobe will be showing the TB symptoms? What of the lobe will be the most likely to be affected? Will it be the apical lobe, will it be the lower basal lobe, or will it be actually other anterior lobe? In which lobe of the lungs will we be seeing the cancer? That is also a potential question. So these bronchopulmonary segments of the lungs are very high yielding topics. And the third, now after that we begin with the hand and legs. But for the hands, I have to say that these hands in total, they are actually the high yielding questions which are coming from anatomical standpoint. Why do I say that? Because a whole lot of questions can come from that. First is the brachial plexus. You have to know about all the problems that are happening over there. If there is a damage, supposedly during a delivery, that is happening of a damage which we can release, which can form a problem into the child's hand. Okay, so not only that, there's a little bit of gynecological approach over here. The second thing is all the nerves supply to the hand as well as to the wrist, which is important. So also the blood supply. So supposedly a blood supply like the question they're asking here, what is the blood supply to this area? Superficial radiality, like the snuff box. Also the question is also on the snuff box. The question is also on the flexor retinaculum. The flexor is also in the extensor retinaculum. These are all the potential questions, and also what are the muscles that are originating it from. So hand is a very high yielding topic, so do not forget to read about it multiple times. Okay, and now we begin with the legs. I've already told you, but one of the high yielding topics that are coming not only from a surgical standpoint and also from an anatomical standpoint is inguinal canal, as well as the ligaments that we have over here, the pectinate line that we see, the inguinal canal that is being formed, inguinal line that has been there, and the contents of those canals. You have to know that you have to know the vas deferens or the epididymis. Vas deferens passes through it, and what if happens, like surgeon clamps onto that, there might be a little bit problematic area. Okay, and the femoral triangle, which is also important, and also the very few of the topics which are high yielding is always the muscles of the legs. So you have to know the muscles of the legs. This is also important topic. Muscles of the leg as well as the nerve supply of the legs also, right? So many of the questions are framed if the person has damaged the right side of the leg. Question that I faced with the leg is having that the leg getting damaged, and after when the patient is onto the bed, the lateral part of the leg is touching the bed's corner. So that is the questions that you get on the leg, most commonly the nerve damage ones. Okay, and where is the artery supply behind the malleolus? Also, these are some potential questions again. From abdomen that we have is like having celiac trunk, as well as the branches that are supplying to the stomach, as well as the spleen, pancreas, and all those are very important. And the exceptions that happens during a time, these are the things that you have to remember, because the blood supply to the stomach is also an important question. Not only the blood supply to the stomach, but also the blood supply to the large intestine is highly important. Look out for the points of the washout areas that we see. All right, and what is the arteries which are supplying that? I believe you might get them on the Google image section. Then for pelvis is also very high yielding topic. The questions that we come across onto the pelvis are mostly regarding the pelvic perineal spaces. So these patients come in with so pelvic diaphragm is one important topic from the pelvis, as well as the pelvic perineal space is also important topic. And in that, usually the patient comes in with the accident and the blood gets spilled into a pouch area. And what is this pouch area? And when you're trying to give up a rectum examination, you get to feel a bulge. All these things will be forming a question, so do pay attention to pelvic diaphragm as well as the pelvic spaces. Okay, and then again we also have a bladder over there, bladder anatomy, bladder exostrophy. So bladder exostrophy, which can be happening. So these ones you will be studying it not only in the anatomy but also in the different subjects. So you have to be aware of. From abdomen that we also have is the kidney, and the kidney anomaly that we see, like horseshoe kidney that we have to see. Well, that is in the embryological side. We'll talk about the embryology in slide a while. Then we also have portocaval anastomosis that you have to know about, which is also important topic. And the patients who have developed liver cirrhosis, they can actually have the problem over here and can develop the esophageal ectasia, and then also would have problems in hemorrhoids onto the anal side. Okay, so the questions can be framed in such a way.